So let's talk about the palliatives now, because the federal government has said they were going to be giving almost 4 million Nigerians, some sort of help, with regards to sustaining themselves with cash transfers, some with food distribution, and all of that. What have been your thoughts so far on how this has worked out?
To be honest, yeah, we all have our suspicions of the government. We don't trust the administration and all that. They said they were going to give 2.6 million Nigerians palliatives. They're going to distribute it to them. They upped it to 3.6 million Nigerians, and as a matter of fact, I personally do not know anybody who has received that palliative. I mean, in other countries, you hear that people are getting their stimulus checks and all that, and they're posting it on social media and all that. But it does make sense. I mean, if I'm going to play the devil's advocate, it does make sense that we don't know the people who are receiving these palliatives, because according to them, it is given to the poorest of the poor. And considering statistics and all that, the poorest of the poor means those people who probably do not have access to social media and all that. So we're just hoping that the distribution is getting to the right people. We hope that there's going to be an audit at the end of the day, so that we're going to know if they distributed to all the people they said they were going to distribute to. We just hope that this is not some people are not profiting off this misfortune, which is typical of people who are in the system. I mean, these are all the things we can only hope for. I'm ready to give them the benefit of the doubt, because I don't want to fight at this point. I'm ready to give them the benefit of the doubt that they are doing what they said they're going to do, but we hope that there's going to be some transparency and accountability at the end of the day. That is very important.
Yeah, a lot of people seem to be on the same page with you with regards to not being able to see the distribution happen. It's not even necessarily about knowing anyone who's in that category or in that class. But I mean, if these things were happening in your community or in communities that you know of, we would have heard or seen them. But most people in Lagos, there's certain states seem to be exempt from this. I know some state governors are doing things on their own, but the federal government's help doesn't seem to be for all states affected, especially considering the fact that certain states are more affected than others. Where are these things going to? And still talking about states as well. I know Lagos State government is trying to do something on their part as well. What do you think about the Lagos State government's effort?
So and I have to say, first of all, I've been impressed by the Lagos State government. I've been quite impressed by their handling of the spread of the coronavirus. How the governor has always been, out there, putting himself out there, communicating with people and all that. But then, while we praise when praise needs to happen, let's also tell the truth about the things that we've seen, the things that we've heard. We've heard about streets, we've heard about communities where the supposed distribution that got to them, say 4 bags of rice for a community of about 1,000 people. Like, how does it even go around in the first place? So while I do say the handling of the virus has been pretty good, pretty decent, how the governor rallied the private sector and all that, while it has been commendable, the truth is that the distribution of palliative has not been impressive. We find out that the federal government's lists excludes certain states. Lagos State, for example, has the most cases. Lagos State started a lockdown even before the official lockdown. It's sort of a lockdown before the official lockdown. Lagos State is the most affected. How come the palliatives are being distributed to people in states that are still, going about like business as usual? It's a curious case, and while one can say Nigeria is not so rich that it can handle, spreading to as many people as possible, still there's a fault in the system. There's a big fault in the system. Our records are poor. Our methods of distributing stuff at this point is plenty of. I mean, these are peculiar times. These are extraordinary times. So I understand mistakes can happen, but then going forward, there's a lot of lessons to be learned. How to plan for events like this. How to not exclude, how to not decide people who are most vulnerable, people who need these things more based on political leanings. No, it's not right. There's a state that has been on lockdown. There's a state where people are not moving around. That state should be prioritized above all else.
I know there's whispers, across the country about a possible extension of the lockdown. We don't know if that's going to be the case. Most people are advocating already that it needs to end because people need to go back to work because there's hunger. But there's also talks about, the state governors saying that we need at least 2 more weeks of this lockdown to happen nationwide. We're talking a lot about hunger here. You live in Lagos, I believe. Looking at the situation in your community and in the state as a whole, and across Nigeria even, can Nigerians handle another 2 weeks?
To be honest, there are merits for every argument, every part of the divide you're on, whether you want the lockdown to continue or you want the lockdown to be lifted. There's an argument, there's a valid argument for your position. But the truth is this: our systems, our healthcare systems cannot handle more the if the cases increase, like if the cases go out of hand, our healthcare systems cannot handle it. While we're not particularly sure what's happening in Kano, Kano is an example of what can happen when things go out of hand. So if the government is saying we're locking down for another 2 weeks, let us understand that 2 weeks, it is for our own good. Now, I might be saying this from a place of privilege. I don't deny that. There are people who actually need to go out to feed, need to go out to survive. I could say that that there should be a general lockdown, but then people who need to, go and get food and get stuff can still do it. The lockdown, at the end of the day, the lockdown is very, very key for it not to spread further. We've crossed 1,000 cases. A month ago, we're about 50. Now we're over 1,000, and it's scary how fast this thing is spreading. So if they are saying another 2 weeks lockdown, it is important that we stick to it. Now it is now the responsibility of the government to ensure that the crunch is not being felt as much. Of course, it's going to be felt, but then they cushion the effects of the lockdown, which is why they should increase the number of people who are getting these palliative measures, and then they should also not just increase the numbers. They should go back to the drawing board and look at their list and find a way to ensure that people are not suffering as much as they currently are.
Okay, I want to say from tomorrow, the lockdown is supposed to end tomorrow, hypothetically speaking, or at least based on the facts we have on ground. We don't know if there's going to be an extension tomorrow. What are your expectations going forward in the new week?
So if the lockdown ends tomorrow, my expectation is that people still take protective measures, go out only if you need to go out, practice social distancing, sanitize always, wear your face mask. Wear gloves if you can, disposable gloves if you can, of course, and don't touch your face. All the things we learned when we heard about the virus. Let's all start practicing it. If we do have to go out, I would not recommend. To be honest, I would not recommend. And I'm saying this for selfish reasons. I know a lot of people feel the same way. I understand why some people will want to go out, but I would not recommend. Our systems cannot handle it. But if we do go out, then let's all practice safe measures so we don't all fall sick. But if the lockdown continues, let's all persevere and let's still go out only when we need to go out. And let's hope the government does what the government needs to do to ensure that the country, the people who pay taxes are not suffering at this particular time.
All right. And I want to ask you, Chidi, now, if you can hear me. A lot of people spend their evenings these days waiting for the NCDC to tweet out the number of infections per day. And of course, there's been a noticeable spike in numbers in the last week or so because most people have said there's been an increased number of tests being conducted, which is, of course, welcome. But do you feel like the tests are enough? A lot of people still believe, compared to a lot of states or countries, at least in the region, we are still doing very poorly, which is why there's a fear of lifting the lockdown. Are we ready? Do you think there's enough tests have been conducted or are being conducted in Nigeria yet?
Absolutely not. Absolutely not. It's shocking. It's surprising how little we're testing. Like, how is it that a country with a population of between 150 to 200 million, we've done just about 10,000 tests? That's if we've done up to 10,000 tests yet. I'm not even sure. Last I checked, the numbers were below 10,000. We've tested so little that it's when I think about it, when I ponder the fact that it is possible that we have way more people who are infected who've not just been tested, I mean, the thoughts are scary. The thoughts are very, very, very scary. We're not testing enough. We've not tested enough. I think the NCDC should widen the testing net, make it open to more people, make it accessible to more people. We have, again, last I checked, we had a capacity of 1,500 per day nationwide. So we should be testing at least 1,000 every day.
Yeah.
I mean, let's just find a way to make sure that we know the exact, or at least an almost accurate number of people who are infected by this virus, because the less you test, the less people know, the more people go about their business like it's nothing, and then the more people are infected and infecting other people. Well, I mean, we're sitting on a time bomb, and I just hope it doesn't explode. Again, I refer to Kano. While everything is rumors right now, and I'm surprised the deputy governor is not here like he was supposed to be. While we don't know what's actually happening there, it is possible that the numbers are spiking as a result of low testing, not finding all the people who should be tested and all that. So we should increase testing. The numbers will scare us every day. The numbers increase. Yeah, we're scared, but then fear brings caution. So let us